Next up, thank you, Dr. Monday. Next up is Mr. Craig Collins, and I want to get things loaded up for you. So again, Mr. Craig Collins, he's our Senior VP, Chief Financial Officer. That's a part that you may not know that he is for UK Healthcare, but he's also, of course, the part that you do know, the CEO of the Beyond Blue Corporation. And so he's here to speak to us, and he was here as part of the VP series. Obviously, we're going to cover quite a bit of stuff here, and he's going to touch base on it, and I'm just going to hand it straight to him and let him dig right in, and I'll push the button.
You'll push the button?
Yeah.
All right. Well, thank you, Chair Harper. I appreciate it. And senators, thank you for having me. I appreciate being here today. So a few things I thought I'd go through is first, I'm going to go right on to the kind of an agenda. I'd like to talk a little bit about what my role is, so that as part of the VP series, and talk about UK healthcare and what I do there, but then also to talk more about Beyond Blue and my role there. And as we roll out through Integrate Blue, what is it? Where are we at with it? What's the current status within Integrate Blue? And then kind of the next steps that are following that are coming in the following months for us to continue implementation. So, Carl, why don't we go ahead and go to the next slide and talk about UK healthcare. So for me at UK healthcare, my role is across to be responsible for all of the accounting, the financial analysis, the payer administration, so our impacts with Aetna, with Anthem, all of those payers that we deal with as an organization, the revenue cycle, how we bill, how we collect, those activities within healthcare. Healthcare information technology, I share that role with Brian Nichols on how we manage the healthcare activities until we go to the next step of Integrate Blue. Facilities management, supply chain, and strategic planning and modeling. So 5-year forecasts, 10-year forecasts. What are we doing so that we can afford to provide access to our patients, like the new Markey Cancer Center building and the advanced Markey Cancer and Advanced Ambulatory building, along with the future that we're planning on the addition to the Chandler Hospital. So those things fall within my span, and of course we support these areas: Chandler, Good Sam, Children's Hospital, Ambulatory, Beyond Blue, and those activities that are there as part of healthcare that Eric pointed out that we take and share with our board, with the healthcare committee, every time they meet on how we're doing financially with those functions. Why don't we go to the next slide?
I'm trying. One moment here.
No problem.
They let me.
I'm talking a little bit. That's all right.
They let me know that I was not sharing, so now I've got to figure out how to get this out of the.
Carl, do you want me to do it? You want me to take it from my computer, or do you?
There we go.
You got it. All right. Well, I just thought real quick, I'd throw up a little bit of an org chart that shows that. This is how it's all lined up. There are key individuals that you may or may not know that work with UK Healthcare: Jake Stover, along with Emily Bortz and Justin Campbell, Lynn Murphy over the facility side of our activities. We also have Elaine Yance, who's dealing with all the payer relations. And then the connectivity then to the two other healthcare organizations, Autumn McMahon, who has resigned. She's still a part of the team today, but we're looking to replace her role here in the future, along with Chris McClug over at UK St. Clair. It just gives you an idea of the folks that make it possible and really do the work to make sure that we're able to capture the functions of UK Healthcare's finances. Why don't we move to the next slide, Carl? I stole this from Angie Martin because I think it tells a good story about why we're doing many of the things we do today. She presented this to the board when she did her update to the on the budget process last year in June. But this just gives you an idea of the amazing growth that has taken part across this organization. Now, you'll see that gray bar, that's healthcare. It's grown almost 270% over that period of time, if you just look at that. But I think one of the important things is you see athletics, it's had some growth. It's been somewhere in the neighborhood of about 25% over that time period. But then look at the academics and the higher education and the growth there. And I think the big thing to point out is we are all growing, and if you just look at percentage wise, healthcare grew about 1.1% from 25 to 26, but academics grew almost 6.9%. So we are growing as an organization. And if you think about the things we're doing as an organization with Integrate Blue, Project Blue Connect, the things we're going to talk about here in a minute or two, is how do we protect this base? How do we make sure we continue to grow, but we do it with the resources we have today, and we protect those resources? So we'll talk a little bit more about that as we get into more of the discussion around Integrate Blue and Blue Connect. The next slide is a whole bunch of numbers. Because I'm an accountant, I had to put a whole bunch of numbers on a page, but this is the budget that was presented for healthcare at the board and was approved. And I think the thing to just let you see how big or the dynamics within the healthcare organization. If you see the UK healthcare, that is the Lexington practice. You can see the bottom line that we're projecting is about $240 million for next year. That's what we budgeted. Royal Blue Health is about is going to be at about 44 million. And you see Clare Blue Health at about 9 million. So total contribution or budget's about almost $300 million within healthcare. You maybe saw the note that came out from Eric just yesterday that talked about a very important component. And very important to that is really how we're able to partner and understand the funds flow that come from the Medicaid directed payments and the work that's done by the organization there. That is what helps us provide the access to our patients across the Commonwealth. Those dollars go in to help us with the facilities that we build, how we pay our staff, how we continue to be able to be a part of the university and continue that growth. And I think that's a key part for all of us to really know how hard our folks in government relations work in all areas of the organization to make sure that we're continuing the funding we need to do our job. Chair, well, let's go on into Beyond Blue and let me talk a little bit about the role of Beyond Blue. Eric touched on this, and I think this is the key thing. In all of the entities within Beyond Blue, as he pointed out, all report to the University of Kentucky trustees. So we are all university employees. If you think about as we move forward with this organization, with Beyond Blue, branding of Beyond Blue is we're the University of Kentucky, and then there's Beyond Blue. And it's shown here in the way this is depicted. So it is a holding company. Beyond Blue is where employees that work in the shared service functions that will move from IT, that will move from the rev cycle, that will move from many of the other areas of the organization, they will be employed by Beyond Blue. But it's the University of Kentucky that we all work for. It's no different than University of Kentucky Pharmacy. But it is a different entity, and it will have their paychecks will come from that entity. Beneath Beyond Blue then is the Baby Blues or the LLCs. So that's where we've established Royal Blue Health or Ashland, King's Daughters. That's where Clare Blue Health is. St. Clair, they're in Moorhead. Champions Blue, that's where it's moving and the activities, it's already moved in some ways, but the staff will move next year, many of them. And then Insure Blue, which is our captive insurance company that really is there at this point in time. We were able to acquire it or bring it along with the member substitution of King's Daughters. That's there to help us with our malpractice insurance and the healthcare environment. But it also has other capabilities for us if we think about cybersecurity and how do we start to do some self-insurance in the future using that offshore captive insurance company. So those are the areas in which that fall up under Beyond Blue. And as Eric alluded to, there may be more Baby Blues that come before we're done. He scares me when he says that. but we definitely, Eric, we're probably going to have more. So that's the structure. Chair, can we go to the next slide? So these are the individuals that when I put on my CEO hat in Beyond Blue that are reporting now and will be a part of that shared service organization. I think all of you know or should know Brian Nichols as our chief technology officer. Emily Orts is going to be the enterprise revenue cycle leader for the healthcare side of the organization. Beyond Blue Health HR Resources is Jamie Pearson. Jamie is it was his original job, or his location is over at King's Daughters. Beyond Blue Finance was going to be Adam McMahon. I am going to be her now for a little while until we determine how we fill those shoes, which will be a big lift for us. And then the Beyond Blue supply chain is Jason Duffy, who is also over at King's Daughters. So that's the leadership team that is a part of Beyond Blue. So let's talk now about Integrate Blue, and I know that we've talked about it some once before when I was here with a group of some of the senators. So let's go into a little more here. And I thought I'd set the stage when this was kicked off. This is President Caputo was really the one that kicked this off, and it came when all of the I don't know, I call it turmoil in my book, of all the changes that were before us that hit us in every aspect of this organization. We didn't know where funding was going to come from healthcare. We weren't sure what at all, and we still aren't totally sure of everything. We still don't know what's going on within our federal grants and some of those activities, as one of the other senators asked questions about. Athletics, there's so many changes in athletics at this point in time. So all of those things were happening and were upon us at that point in time. And really, when he came to his leadership team, and I was asked to participate in this, he was really all about, let's protect what we have today. We know we are going to grow, and how can we do this in a way that we can maintain the staff that we had? And he is very passionate about that. Growth is our goal, that we are going to grow out of this as we continue to be an organization. If there are headwinds that we need to really work towards, that there would be no reduction in our workforce. He really wants to make sure that we're committed to our people. There may be changes, as we're going to talk about, on reporting relationships and things, but there is no reduction efforts. I think one of the things that I went on a little bit of a speaking tour with a few of the organizations recently, and they asked about this, and they're like, seriously, you aren't looking for cost reductions? We really aren't. I mean, there will be things that will change. We'll see things that will probably bring us some efficiencies, but it will give us opportunities to grow. Most people go into this with an idea that we're going to cut, 500 people or 1,000 people. That is not at all ever been a part of the discussion on how we're putting together Integrate Blue. Increased career opportunities. It is a chance, as we start to pull together into a shared service, that people have opportunities to grow within their profession or across professions. So we're wanting to be able to open that up. Some people may not want to. They may want to stay and do the same thing they've done before. And guess what? They're going to get to do that in Integrate Blue. A lot of things that change are the reporting relationships, and how do we keep that line of operations and understanding of what's going on within those work units, so that we protect ourselves from the outside forces. I mean, an example, of course, it's an easy one, is IT and cybersecurity. How do we continue to make sure that we have oversight over all the areas where we have IT silos in many cases, and they'll stay that way, but how can we continue to have a direct line of contact through this integration and the reporting relationship? So that was really the foundation and how we were set off to work through this. Why don't we go to the next slide? So here are the areas that have been touched, and the future areas that will be touched as we work through Integrate Blue. So there are areas that are already centralized. It started in January. And so those 4 areas of enterprise internal audit, enterprise legal, EOE, and healthcare compliance, they are now all reporting, regardless of whether they live in Moorhead or they live in St. Clair or in Ashland or in other areas across the university, healthcare and the university. They're now reporting directly to one leader. So everybody's going to Joe Reed. Everybody's reporting that are making legal decisions that impact the outside environment report to Bill Thrope. Healthcare compliance is going to Brett Short. And with the EOE, it all falls up under Gina Dugan within her organizational structure. Centralized by July 1, this is when the move goes forward as we start to centralize and move the enterprise IT into Beyond Blue. There's still many discussions going on with that. I'll share a couple slides on where we're at with IT. Marcons will centralize also by July 1, but they will centralize within the university. They will not, and there are Marcons people that are over in King's Daughters and are also over in Moorhead. They will work under Jay Blanton. They'll stay in Beyond Blue because, again, our commitment is that we won't change their benefit structure. So for them, it's a reverse side. We want to keep their benefits that they have at King's Daughters and at Moorhead. We want to keep them the same during this transition. So we're grandfathering them in to that process. Same thing with our university employees within healthcare and within the university that would move into Beyond Blue. Student Success is right now going through a lot of their process. They've sent out their surveys, and right now they're going through the analysis of how they're going to move forward with Student Success. And then Enterprise Security is right in the throes of it. We got Chief all over the place. He is working together with the team of really bringing us together with one, how do we brand ourselves with security when we have security at King's Daughters or Moorhead, or for those of you that work within the within agricultural areas, you know, we have to make sure we're secure within many of those areas too. So trying to pull things together under one leader with Chief here by July 1st. And then there are 4 other items. I'm not going to get in the middle of those because I know you got some questions, but those are under consideration. We put them on a sheet of paper 9 months ago. And some of these may happen, some may not, as we get into more details of what they do and how they interact with each other. So some may continue, portions of it may continue, but we're looking at everything. There is a next step. I'll tell you that, because the gentleman that was here before me, he's going to continue us moving forward. So the next areas that will be looked at for shared services will be finance, it'll be HR, all of HR. It will be all of some of the supporting areas within administration. These are the first. There will be more to come. I can guarantee you as we continue to work through this process. But again, I think the important thing to all of us is that this is all under UK's leadership. It is, even though it may be in a different entity, as he pointed out, it's still all under UK's leadership moving forward. Why don't we move to the current status of Integrate Blue? So at this point, I think most of you know there were surveys that were sent out to all the impacted employees for them to be able to fill out and explain what their jobs were within IT and Marcons. So those surveys went through a process. They went through a work group. We did use Deloitte to help us with this. They helped monitor and really combine the data and put it in a format that it could be easily accessed and that people could actually go through and do some comparability. Once that was done, and the promise that was made to the deans and the work units that are affected is that we would go back to them with the results. Because we really wanted to understand if Craig Collins filled out the survey and said that he does X, Y, Z, and the dean or the business leader said, I don't know what they're talking about, that's not what he does. We wanted to have that opportunity to have a conversation and redirect and update the information that was received, go back to the individual or be able to have that dialogue so that we really knew where people were at. There were 35 meetings that took place with the deans. We know there's 18 departments, and I think then there were about 5 other business units. So there were repeated meetings that took place through this process to be able to go back and forth. Now, I learn every day that communication is something we always are challenged with. We charge people at that level to help us with communication. Sometimes it happens, sometimes it doesn't. I'm learning sometimes now that the rubber's hitting the road, that people are going, I don't know anything about this. What are we talking about? So we've got to continue to do a better job of communicating as we work through this process. And I'm just being very transparent to you. After they met with the deans and the work units, they went back again to do the data validation. That's where, if it was pointed out that this was not the issue with the individual, they were able to update things. They would take that information and then reformat it. It went through the last process where they really spent time to look at each one of the individuals and understand, based off of those results, how much time did they really spend doing IT? How much time did they really spend in the Marcons area? Because when you get down to the bottom here, you'll see that we have people that fully 100%, it was pretty clear, this is what they do. But there are fractionalized activities, as you would guess. And that's where we have to focus some of our time. I do 80% of my time, I'm down, heads down doing marketing or communications. But that other 20%, I'm doing something else that's part of the college and is very important to the college or the business unit. So how do you fill those gaps? So that's the next part of the conversation that is taking place right now. So they were categorized in basically 4 categories. Fully centralized with a fractional role based off of 20, basically the 80-20 rule. So 20% isn't, and then on the other side, that 80% and 20% was part of marketing. And then do not centralize them at all, didn't make any sense. So that activity has taken place. And in the last week, there were communications sent to the deans, to the business units for them then to share that information with the employees. And that was done based off of the dean's discretion or the business unit on how they wanted to communicate to those employees. And then it was followed up with a letter from the leader, from Jay and Julie, or from Brian and his team, depending on the work activity, about 5 or 6 days later. Carl, when we go to some of the results. So this is IT. When you look at where things are, and what I like about the way this is displayed is it's all in. Every area of the University of Kentucky was included in the process. And I think the numbers might amaze you in some ways, but when you look at the head count around IT already centralized, when you bring in UK Healthcare, UKKD, UK St. Clair, those came in just before we went into the Integrate Blue. There was that whole Project Blue Connect where we integrated everybody into IT in the June-July timeframe of last year. So that's why they're categorized as already centralized, but it takes us to 923. The areas that through the process that were fully centralized, that make a lot of sense to pick up and move because 100% of their job is done, focused on IT, is 165. There are 65 that we're looking at fractional activities, and there are 17 that we're saying don't centralize. But the important part here is we've got to figure out what to do with the fractional work. And we can't add more resources. We want to make sure that we're doing the right thing. So how do we cover that so that the colleges or business units aren't exposed? I would say another thing in the fully centralized group in IT and in Marcons, one of the areas that we're really under a lot of scrutiny on is to understand we don't want to leave a dollar on the table on funding sources. So a very important part of our analysis now is around grants and external funding and how do we, you can do it, but we may not be at the point in the way that we've established some of our grants to be able to have a purchase service or a contracted service, because you got to do some of that up front in the way you submit your documentation for the funding source. But other organizations where they don't have a huge IT organization or they choose to outsource it, there's ways that you can do that, and you can do that also internally. So we're looking at those individuals, and maybe what will happen is they'll be centralized within the university, but they'll be centralized. We're going to continue the process, but we got to determine whether they go to Beyond Blue or whether they stay in the university. There's discussions around that. They may all go. We may find a way to make it all work on January or on July 1 to move everyone. Why don't we take a look at the same information on the next slide for Marcons? With Marcons, as you can see, there's 102 across the organization that are already centralized. Fully centralized persons that would pick up and move are 149. We have 58 to really look at around that fractional work. And then there were 73 that we decided they should just stay. That's their job. It was a hodgepodge of things that they're doing, and it just doesn't make sense to move that. So that's the outcome of those two areas. I know you're very interested in those. The next slide just takes you to those others that have already been centralized or are on the plate to move. on the July 1 date, but you can see where finance is at. Most of that is around the shared services within King's Daughters and Moorhead. That's where that sets. The same with healthcare compliance as it moved to UK healthcare. Human resources, internal audit, legal, revenue cycle is huge. Lots of people that do billing for healthcare. And then security and supply chain as we're starting to work through that process and understand where those gaps are. So those are the results of the information. We're still working through it. It's not all finalized, as I pointed out. There are iterations that continue to go on. So the next slide really is what are the steps that we're working through and what was the timeline. So you can see in January, the deans and the unit leaders received that list. That's when they were to send out their work. In February, we've got UKHR sitting at the table trying to work through this fractional work activities. And I think one of the things we really learned through this process is we're not very good at keeping our MJRs up to date. People really, they change, we don't keep them up to date. This is an opportunity for us to clean them up and get things in the right order so that when we're starting to compare things, we've got information around that. One of the key things for the business units in the colleges is to have service level expectations. We had a focus group and the voice of the customer with about 5 of the deans and some of the business units just to start that conversation. What are the expectations? Because it's a two-way street. It's not just the shared service. It's got to be back with that work unit and how do we work together? It won't be one size fits all because they're all going to be a little different. And we got to make sure we acknowledge that through this process. People ask about budget for the colleges and the business units. Budgets for the employees that are going to be moved will be pulled from the college and Angie Martin will manage that budget. And the costs will go to Angie Martin's budget. It won't be an allocation back to the groups. So that takes the money off the table. Unless, for some reason, there's something that's very nuanced for a college, they're doing something one time, they need a whole bunch of marketing people because they've got a huge plan that they're putting together. We may have, one-off chargebacks for those things, but that will be a negotiated discussion with that business unit or dean on how that might work. The org charts for finance, IT, and Marcoms at the latest will be 1st of March. That people ask, well, why didn't you have that already? Well, we didn't know who the people were until January 28th. That's when that was finally finalized and didn't know where everybody was going to move from because it was an iterative process and a continued dialogue. So they're hard at work at figuring that out. College and unit MJR realignment will take place in April. End of April, we'll have the map ready. And then in June, that's when the communication on the move will actually take place and we'll have the full details to continue that process. So I'm going to stop right here. I think, Carl, you asked if I could take some questions, and I'm more than happy. I will answer what I know. And there may be some things we're still working on.
Let's see, get this thing started. So,
You got
it. We have a few minutes. I did say 5 to 10 minutes. So
I set it for 10.
You said it for 10. So
All right.
we got that. So we'll start with questions. And I see Senator Pinkerton, you are up first.
Sorry about that. I hadn't unmuted yet. Yeah, Senator Pinkerton, Center for Applied Energy Research. And I'm specifically asking for me and my couple of coworkers because we're such a weird edge case. But we're over half grant funded in our position. We were chosen for centralization, but the center is its own line item in the state budget, not part of the UK's main budget. So, how are we going to be able to balance our grant required work? Because some of these grants are DOE, some of these grants are state, and some of these grants are I think I'm on an NSF grant too. How is this work still going to be balanced within our unit without affecting their funding, but also be reflected in my new role that will be centralized?
Sure. So the first thing, just to be totally transparent with you, no one is going to move in the first round at all in any way, shape, or form from the place that they're working and having their day-to-day direction from, in your case, from whoever your investigator or whomever the leader is that's responsible for your grant funding. You're going to have a dotted line with them. They'll be working with you on your day-to-day activities. The line of supervision or the access, so that we're looking at the activities across information technology, will change to that central service or that shared service process. You're right in the complexities that we're working out is how do we make sure that we don't lose a dollar? And that's where we may have to have some little different model for some individuals or some of the grants or some of the external funding that's taking place today. So we're working through that process and determining how that will take place. We have 6 months. It will have an effect on you and your job. I know that in some way, shape, or form as far as the supervision, but we can't leave a dollar on the table. We do not. They're too precious, and we got to make sure that we continue that funding. So that's what I know at this point in time. We're working with legal to figure out how do we paper up some of these transactions. Or are there areas that we have to wait until the next time that the grant or the activity renews, and then we take a different approach with it? I know that that's not a total, this is dead on what we're going to do, but that's the work that's being done right now as we work through this process.
Okay.
So thanks, Senator, for your question.
I'm Senator Aaron, Clinical Translational Science. I just one point I wanted to make is I would encourage you to use the Employee Appreciation Day as an opportunity to maybe do some marketing around Beyond Blue.
Okay.
Because it's just a time when thousands of people will be together at some point. So it's a great opportunity to share the most up-to-date information about whatever you want to regarding the project. Maybe have a table or something. Secondly, I'm hesitant to ask this, but I work in the research IT space, and so therefore I've had some team members who are going to be impacted and some who haven't.
Mm-hmm.
The common question I'm getting is, why were people selected and I was not? And so I just didn't know, is there anyone we can talk to at this time if people have questions about
sure.
how was it? Because I literally have people who had the same role.
Absolutely. I'd be open to having a dialogue, and we get some folks to talk through it. I can get the right resources to talk through it with you. You know, the first original process was they went through and looked at MJRs.
Yeah.
And that's where, again, our opportunity for making MJRs to be consistent. And that was the first place that we started to look at. And that's how some of the deans, some of the work units said, hey, wait a minute, there's other people over here that doesn't say they're doing the same work. Let's bring them to the table. So they add them. Some other areas it wasn't caught. It was not a discussion that took place. And so be perfect to have that conversation and see how we want to be consistent. You know, that's really what we want to do. And I love your idea about coming to the appreciation. I think that's a great thing. We aren't going to print shirts. We're not going to have a t-shirt that says Beyond Blue on it. That's not going to be the marketing process. It's going to say UK is what it's going to say on it, which I think that sends a huge message to what we're doing here as an organization. Tagline might say something like Beyond Blue or something along that. If you look at our healthcare organizations, it's UK King's Daughters, UK St. Clair. So we want to make sure, and I was just at King's Daughters on Tuesday. They are so proud to be UK employees. So the brand is so important to us on how we do our work. So thank you for that. That's great. Both of those things are wonderful.
Great. Senator Larmore?
Sorry, VP Collins. I wanted to ask about one of the things that's been kind of reiterated through the process is about the idea that benefits aren't going to change. But I think that practically a long-term system where benefits are fractional and people within the same organization have very different looking benefit structures is probably not realistic. Do you foresee that at some point in the future there will be a kind of a leveling of benefits of those among that are in the King's Daughters or the Beyond Blue organization, whether they're King's Daughters or St. Clair or, direct Beyond Blue employees, shared services, or Champions Blue?
Great question. Let me address the process that we're working on right now. Is I think when we talk to lots of employees, the thing that's very important to them is their length of service in the organization. We want to make sure that that doesn't change with anybody moving across, because that drives many benefits. So that is one thing, anniversary dates will be kept. Number two is that we want to be able to tell all employees that whatever retirement system or process they're under today, that's going to be sustained. We're building those activities or that function within Workday. Number three, on healthcare benefits, that's only something we go out to market on every couple of years. So for the whole of the university and everybody, those things right now, they're not going to change. You're still going to, if you're in this room and you've got the PPO or you have UKHMO and you're a part of this transition, you're going to get to keep those for the first year or two. And then, just like the rest of the university, who knows where we may go out and get the right price. And we may do everything for the entire university. We may do it only for segments. We might do a Beyond Blue, and the University of Kentucky does something different. The reason for that is that the healthcare guy here, when you look at payers, sometimes they don't cover things in the same way that they do across the Commonwealth. So here in Lexington, when you look at things, Anthem is they're pretty much across the whole Commonwealth. But when you get into other segments of the Commonwealth, it's not Anthem. It might be Aetna, or it might be United, or it might be someone else. So we've got to keep that all as an open discussion as we look at the way we provide healthcare benefits. So that will be one of the areas that could change, but it could change for any one of us as we go through this process. It doesn't matter where we're at, because we just did an RFP 2 years ago and went with Anthem. The other thing that we are going to need to look at as we move through process, and Vice President Melissa Frederick is really working on a charge from Eric Mundy for all of us. He really wants us to start to have choice. He does not want it to be that future employees and even us, as we get into other areas, that we may have the opportunity to make choices with our benefits. And I think Beyond Blue will be that area that we'll start with, that could come forward and say, okay, we're going to allocate X amount of dollars that's the same amount as what we're paying today, but you can figure out how you want to spend those. We may say you got to have 5% in your retirement, because we like to protect each other, but the rest is yours to spend. You could take it in salary. You could take it in potentially housekeeping or some different things like that that is pertinent to that individual, so they have choices. So those are the things that Elizabeth's working on as we work through this process.
All right.
Does that help?
Chris?
Yes.
Yeah, okay. Well, our time is what it is. I know Justin had a thing on the chat there of talking about the benefits, TDL, vacation days, but we can always work on getting an answer for that. And
We can come back, or I can come back with written responses to you.
I would appreciate it. Thank you so much.
Senators, thank you very much for your time. This is important. I learned from you. This is a two-way street. So thank you so much.
Oh, yeah. Thank you.
Thanks.